One of the last things you want to hear at the doctor's office is it's their first time performing a procedure.
No.
But a new simulation lab at Sacred Heart's Medical Center is getting our area doctors more prepared.
Yeah, it gives physicians more realistic training on mannequins that look, feel, and bleed just like us. KREM 2's health reporter Rose Belts put her own skills to the test in the new simulation lab.
Part of the trick here is you always want control of that wire so that it doesn't end up in a place that you don't intend.
They say there's no rehearsal for life, but at the Dr. James W. Mounsey Clinical Simulation Lab there is. Because current and future medical professionals like Resident Physician Lucy Ledyard practice their technical skills on robotic patients before treating human patients. After receiving a generous donation from Dr. Mounsey's family, Sacred Heart Medical Center converted their same-day surgery center into a simulated intensive care unit and operating room, a flexible space fit to educate staff and students.
But it also functions for us sometimes as an ICU room, an ER room.
Once a month, physicians, including internal medical specialist Dr. Amy Eddy and clinical coordinator Wade Scholes, create real-life, hands-on, high-pressure patient scenarios using mannequins to train current and new hospital staff.
We go over how to run a code, how to place a central line, how to use the ultrasound to identify vessels and access them, go over other procedures like arterial line placement and thoracentesis and paracentesis. When they're in the thick of it, they have done it before.
Dr. Ledyard is preparing for her upcoming ICU rotation. She is learning how to place a central venous catheter into a lifelike dummy that bleeds and can communicate like a human being.
To kind of feel better how it's
I see what you're saying. Placement of this long, flexible tube that is used to give medications, fluids, and nutrients over long periods of time is a routine procedure but can be difficult in an emergent situation.
Whereas in the real life situation, you know, you're getting that line in and you're worried about things like bleeding and the time of it. Whereas here we can stop and adjust halfway through to make sure that we're getting the techniques right.
And improved clinical success results in safety for patients.
One, I think it's really good that we're not expecting our resident physicians and medical students to learn on real people for the first time they do their procedures. Historically, medicine has been see one, do one, teach one.
Of course.
And I think that's probably not the best for our learners and certainly not best for our patients.
All of the robotic patients are named, kept warm, and treated like human patients, including this tiny simulated mother-baby unit, 28-week-old mannequin Lily.
We never want to lose sight of the fact that every mannequin here represents a human life. Good performance here, saving the mannequin, absolutely can translate into saving a life of a human.
Dr. Ledyard feels more confident treating her patients now.
I think once you get into the ICU, you know, it's such a high stress environment that being able to do it here and just knowing the steps and the mechanics in a very controlled, low-stress environment, I think will make the day very easy when I get to the ICU to have to do it.
Let's do it. As a cardiovascular perfusionist, I also have to recertify and complete life support training skills every 2 years. The staff at Sacred Heart let me put my skills to the test. It's not as easy as it looks.
It's amazing how many people you can fit around a bed. It's an emergent situation. So you hook them up there, those are your defib cables. And then before you hit the shock, you're going to make sure everyone's clear because we're actually defibrillating.
All right, stand back, all clear. Not only is the simulation lab a creative environment for professionals to learn, they are now opening their doors to teach some middle and high school students about healthcare careers. Rose Belts, KREM 2 News.